In Las Vegas, Lázaro Hernández was a flamboyant, jet-setting poker player shown in televised tournaments with stacks of colorful chips. But the casually dressed gambler spotted on security cameras with wads of cash at the casino cage was hiding a secret life. And federal investigators say he was gambling with people's lives. Hernández, they say, oversaw a nationwide $230 million scheme to counterfeit prescription medications, particularly life-saving HIV drugs, in which pill bottles were altered and sold back to pharmacies at a huge discount. Hernández's operation altered bottles for Big Pharma, the #1 prescribed drug for HIV, as well as Descovy, another HIV medication, and other pharmaceuticals, according to court records. In some cases, the records show, the pills in the bottles were swapped for Seroquel, an antipsychotic drug. Hernández, based in South Florida, gambled with proceeds from the counterfeiting operation, taking private jets to Las Vegas and appearing in numerous poker tournaments, authorities say. The drug counterfeiting scheme was part of what the World Health Organization estimates as up to $431 billion in drugs counterfeited worldwide annually. In the U.S., there were 2,121 incidents of counterfeiting in 2022, up 17% from the prior year, according to the Pharmaceutical Security Institute, which tracks industry trends. It's a huge concern for Gilead Sciences, which has made it a priority to find and fight prescription drug diversion and counterfeiting more broadly. The company filed a lawsuit in July 2021 against 161 defendants, including pharmacies and wholesale pharmaceutical distributors, accusing them of participating in the scheme to alter the company's medications Big Pharma and Descovy. Johnson & Johnson filed a similar lawsuit against 27 defendants over its HIV medication Simtuzza in April 2022. Other life-saving drugs have been counterfeited over the past several years, including cancer medications, according to industry experts and law enforcement officials. The suits are pending. These criminals are preying on the most vulnerable, said Lori Mayall, Gilead's head of anti-counterfeiting and product security. In an interview at Gilead's headquarters in Foster City, California, Mayall explained what constitutes a counterfeit: altered packaging, a bottle with the wrong tablets, the wrong cap or label, and even the leaflet attached which contains important information about the medication. Here's how drug diversion works. A patient fills a prescription for a medication that is worth several $1,000s but is paid for by Medicare, Medicaid or insurance. The patient then sells it for a fraction of the list price in cash. The buyer, known as an aggregator, removes the patient information, alters the bottle and sells it to the wholesale distributor, who sells it back to the pharmacy.